A 68 years old man present with ulcerated lesion on his right cheek. It is excised and on histological assessment, squamous cell carcinoma is diagnosed. So a patient present with the ulcerated lesion in the right cheek, but a diagnosed squamous cell carcinoma, and it measures 25 millimeters in diameter and 4 millimeters in deep, and which is condition is false regarding this statement. So we have to false statement regarding the information of the squamous cell carcinoma. Here the options are in this particular case: margin at least 6 millimeter, use of cryotherapy to treat the patient lesion would have unsafe, use of radiotherapy to treat this lesion would have been unsafe, patient local recurrence rate may be 15%, the disease usually spread via the lymphatics. So what is the false option regarding this question? So first of all, let's see the high risk group, that means who are involved most commonly. This one, first of all, renal transplant and immunocompromised. So in case of the immunocompromised patient, any type of the carcinoma may develop, but among them, one of them is the squamous cell carcinoma. Individuals with the HIV virus, it is also important, because the HIV virus, it also reduce the immunity. Those who have received the Soralen UVA therapy, chronic wound, it is also another cause, which is the Marzulin ulcer. It is a specific variant of the squamous cell carcinoma, xeroderma pigmentosum and oculocutaneous albinism. So these are the risk factor for the development of the squamous cell carcinoma. And what are the prognosis? Here we can see the good prognosis and bad prognosis. So what are the good prognostic factor? First of all, well differentiated tumor. So what do you mean by well differentiated? Well differentiated, that means there is a tumor and this tumor cell type is recognized well, and when there is the definitive outline. But let's say there is a cell like this, that means the irregular border, irregular shape, and it is not not symmetry to the other cell of the body. So in this condition, bad prognosis, that means the poorly differentiated, that means this cell usually not possible to differentiate it. That means the which area of the cell. Then when it is less than 20 millimeter diameter, so when diameter is less than 20, it is good prognosis. When less than 2 millimeter deep and not associated with other disease. And what are the prognosis? Where the diameter is more than 20 millimeter, when more than 4 millimeter deep, and immunocompromised conditions such as the diabetes mellitus, kidney disease, stroke disease, or any other condition like the HIV or other immunosuppressive condition, it causes the poor prognosis. And what are the treatment? The treatment usually surgical excision with 4 millimeter margin of the lesion which is less than 20 millimeter in diameter, and if tumor more than 20 millimeter, then margin should be 6 millimeter. So it is very, very important. When it is the less than 20 millimeter, we should keep margin 4 millimeter, but when it is more than 20, then margin should be 6 millimeter. And let's see in short about the squamous cell carcinoma. It is the second most common cause of the malignancy, and it is derived from the epidermal keratinocytes, and commonest in fair skin individuals. In sun exposed site may occur in perineal and genital skin also, especially when associated with the human papillomavirus 16, human papillomavirus 18 involvement. So the squamous cell carcinoma usually present in the sun exposed area in the white people, and it may be present anogenital area in case of the human papillomavirus 16 and 18 infection. And what are the poor prognostic factor? Here we can see the poor prognostic factor when the size is more than 20 millimeter or more than 2 centimeter, and the local recurrence rate, it reaches up to the 15%, and the depth of greater than 4 millimeter also risk factor. So first of all, when the size is more than 2 centimeter, that means more than 20 millimeter. When the depth is more than 4 millimeter, it is the risk factor. And what are the treatment option? Treatment option are cryotherapy, and another option is the radiotherapy, and radiotherapy is safer than that of the cryotherapy. So which is not true, so which is false regarding the squamous cell carcinoma? What is the false? The false option is the use of the radiotherapy to treat the lesion will be unsafe, because we know the radiotherapy is safe in this condition. Any type of the superficial area, actually this superficial area is suitable for the radiotherapy because there is no obstruction and the therapy directly can go to the lesion. But in case of the inner area, such as let's say this is the pancreas, so we when we want to give the radiotherapy, it penetrates skin, deeper muscle, it can penetrate the other area like small intestine or large intestine, so the more side effect. But when there is more superficial, there is less side effect and it is safe. In a particular case, margin at least 6 millimeter is required. So here you can see the diameter is 4 millimeter and measure 20 millimeter, that means which is the more than 20 millimeter. So in this condition the margin should be 6 millimeter. Use of cryotherapy to treat this patient lesion would have unsafe. Yes, it may be unsafe in case of the larger lesion. The patient local recurrence may approach 15%. It is also true. The disease usually spread via the lymphatics. It is also true.